Hi, everyone. Welcome to the bonus webinar for February. I sure hope I will be able to record it this time. Yesterday, I promised actually that in the email that I sent recently, I promised that it will come out on Friday. And sure enough, Friday morning, I started recording. I even created like a nice video message for you, showing my face and everything. And I tried to record the webinar 4 times, I kid you not. And every time something interrupted me. It was a mailman, my neighbor, the house across the street is being renovated, so they were making impossible noise. And then in the end, when I finished the whole webinar, my recording software just crashed and I lost the whole recording. So I was sick of it, and here I am trying again. Welcome to the webinar, and let's, if you believe in any deity or deities, pray that I managed to record it this time. So the topic that I want to talk about in this bonus webinar for February is about why we need to have a holistic approach to BFRB treatment. By holistic approach, I don't actually mean one comprehensive theory, and that's kind of the point. I mean that we need to look at BFRBs from as many perspectives as possible, even if they're not very coherent or if they don't go well with each other. I will start this webinar from, let's say, more abstract philosophical ideas, and then I will bring it down and analyze a specific instance of picking and show how this approach works in reality and why I think it gives better results than any more reductionist approach. I have to thank one of our BFRB club members. She wants to remain anonymous, so I can't say her name, but she shared her observations and her sketches and her ways of thinking with me. She was asking quite a few questions through the Ask Away link in the VIP lounge. And at some point I said how wonderfully useful her very structured way of thinking is. And she said, well, if you think it'll be useful for other people, you're free to share it with them. Just don't please mention my name or give out any personal information. So I'm immensely grateful for this. I hope you will all find it useful because I think it really, really is. So and one more thing before I start. The reason why we are having a bonus webinar in February is because when I started the BFRB club, I promised to all of you that we will have one webinar every month. And in January, we didn't have a webinar. So I felt really bad. We were doing the self-compassion course, so that took quite a lot of my time because many of you have chosen to participate. And I am really grateful, and it was thrilling to go through all of it with you. The course is still up, and it will be in the members section, available to everyone, free members as well as VIP lounge members. So go ahead and use the course. So that took 3 weeks. And then it was a very long month, let's say, professionally and personally. So I kept postponing the webinar, even though I had the presentation made. So now in 2 weeks, you get 2 webinars. So let's get started. First, I want to introduce you to the notion of perspectivism. If you're a philosopher, you probably know what this is, and you will probably recognize that I am being maybe a little bit banal about it. I'm trying not to, but because this is not a philosophy lecture, I feel the need to simplify it as much as possible so that I don't lose all of you, so that you don't run away screaming because I'm spending an hour talking about philosophy. I will bring this back to body-focused repetitive behaviors, I promise. So perspectivism is best illustrated with this image here on the right. You have a number on the floor and 2 people looking at the number from 2 different points of view. One person says it's a 6, the other person says it's a 9. They're both telling the truth at the same time, even though their truths are completely incompatible with one another. But from their perspective, from where they are standing, what they're saying actually matches what they see, right? So that's what perspectivism is. It's this notion that we don't see things objectively because we always have a specific point of view. If you only look from the left point of view here, you will see a 6, but if you only you will not be able to see a 9, and vice versa. If you look at the number on the floor only from the right perspective, you will see 9, you will not see 6. As a constructivist, I cannot help but say that we really never will know if this is a 6 or a 9, because the answer depends from the point of view. This way of thinking has been present in philosophy for a very long time, but it was formally articulated by a truly intelligent, brilliant man with absolutely hideous taste in facial hair, which is Friedrich Nietzsche. And you can see that here on the right. I mean, that's just unforgivable. But we will have to disregard his mustache because his thinking is far more interesting than his lack of mirrors in the house. So basically what Nietzsche says is that knowledge, all knowledge and our perceptions depend on the framework that we use to understand the world. So all our thinking is predicated on certain assumptions. And it's these assumptions that we use to give meaning to what we perceive or how we find solutions to things. That means that you have a theory of body-focused repetitive behaviors, or if we're talking about emotional avoidance, you have a theory of emotions, which you might not even be aware of, that is leading you to avoid them, right? So there are always these underlying assumptions that tell us what to do with the world and how to understand the world. And these form our perspective. And from our perspective, some things are true, some things are false. But they're not objectively so. We can't really know. Umberto Maturana, who's a Chilean philosopher and psychologist and a biologist, he's a lot of things, said this thing that I really like. He said, everything that is ever said is said by an observer. So you always have a point of view. You can't talk about things without having a point of view. So we cannot understand body-focused repetitive behaviors from an objective point of view, because we always have a theory that we're working with. And my claim in this webinar will be that having one theory is usually to your detriment, and that we need to be more open-minded and diversify our theoretical approaches if we're going to actually help someone in real life. This perspectivism, which is a philosophical theory, not a psychological one, but constructivism has a psychology and it agrees with this, is very similar to a position that's called epistemological pluralism. Essentially, and this is really simplifying things, it's an antidote to reductionism. Epistemological pluralism says that there are many ways to know the world, many ways to explain things that happen, and many ways to deal with things that happen. In fact, in different ways of seeing the world and knowing the world can be divided in such radically different ways that it might not even seem like the same world, right? A poet doesn't seem to see the world in the same way in which a mathematician does. Both of these approaches have their advantages and disadvantages. If I'm being very pragmatic, then I will say it's important for us to get to know different ways of seeing the world and then judge where they are useful and then use them there, and where they're useless and then not use them there. I mentioned that the way that you have been treating your body-focused repetitive behavior, so your hair pulling or skin picking, whatever it is, depends on what your theory is. Most people don't have an explicit theory of BFRBs because most people don't sit at home and analyze themselves to death and come up with a highly elaborate, verbally articulated theory. This is why I say in the title here that a theory is implicit. When I start working with a new client, or when you start your own journey to heal from BFRBs, that's where you start. You start with where you are. I want to meet my clients where they are. I want to see how they think and how they see the world, because everything that they have to say about their body-focused repetitive behaviors comes from their previous lived experiences, right? If you can't formulate a theory, you might turn to a mental health professional, maybe even one who spells better than I do, because I misspelled health. But in my defense, this is my second year in a row where I have decided not to use a spell check for anything, because I realized that if I rely on those little like curvy red lines, that appear under a misspelled word, I've realized that I'm becoming kind of gradually more illiterate. So I'm trying to actually focus on spelling, and I fail sometimes, as you can see here. So you might turn to a mental health professional, and then they will confidently tell you what your BFRB is about. They will just give you a theory, and then you will accept it regardless, of your lived experience, and if it actually fits or doesn't fit. So I usually like to reject any preconceived notions that I have, and then see where you are and meet you where you are. The trouble with psychological theories or biological theories or whatever other theory is that it's generic. Even when it's empirically tested, it just means that it applies to most people. But most people are not all people. I have been working as a therapist for 15 years now. No, 14 years. Okay, I'm not going to do math. Over a decade for sure. And I am yet to meet two people who have the same life story. That never happens. So that's the problem with generic theories. They offer some vague tools, which are sometimes useful, sometimes not. But people are not generic. Everyone is a special case. So what I prefer to do is to kind of develop a specific box using all these theories and all this knowledge, but tailor make the box for you so that you have a theory of your BFRB that suits your needs and fits your lived experience. Here on the left, I put a painting by Basquiat because a brilliant talent that he was, there's only one box that his works fit into, and that box is labeled Jean-Michel Basquiat. You cannot find a generic box to put this man's work in. He was just so brilliant. In fact, I will argue that reductionism of any kind, having just one theory or just choosing something that psychology offers and sticking to it, is perhaps even detrimental. It's not necessarily beneficial. We need a theory because a theory tells us what possible solutions we have at hand. So where we can go and what we can do. But if you stick to only one theory and stick to it very dogmatically, you're excluding practically infinitely many potential avenues of change that could help you. That's why it's dangerous to stick to only one theory. Or as my favorite writer once said, reading all books is not dangerous. It is dangerous to read only one. Because if you think that there is one answer to the complexity of who you are and your problems, I have to say you're then sadly mistaken. Before I move on to the next slide, I can't help myself. So there's a really cool story about him. He's one of the great European writers of the 20th century. He was from Yugoslavia, which is now 7 different countries. So I don't know where to place him. He lived in Belgrade, Serbia, and died in Paris. But he was essentially a Yugoslav or a Central European writer. He died in 1989, and Susan Sontag, the great American literary critic, she said that had he lived 2 more weeks, he would have won the Nobel Prize for Literature in 1989, because he was already chosen. His name was kind of sealed in their little envelope. But because he died of lung cancer before, they had to convene again and vote again and choose a far inferior writer than he is, because you cannot award the Nobel Prize posthumously to anyone. It's really a great shame. If you like short stories, his collection called The Encyclopedia of the Dead is maybe the single best short story collection I've ever read. It's just brilliant. Anyways, we could argue that in theory, in medicine, and in mental health as well, we already use a kind of perspectivist model, a limited perspectivist model. I will explain this model and then tell you why is it that we actually don't use it, even though we officially use it. It's called the biopsychosocial model. The idea is that every problem that a person faces, so a physical or a mental health problem, is essentially an intersection of biological factors, of psychological factors, and social factors. And on the surface level, this applies very easily to body-focused repetitive behaviors, right? So there's the fact that we all live in bodies that are biological, so we can't escape our biology. It plays a part. We know that grooming behaviors are present in other animals as well. And we also know that grooming behaviors tend to go haywire in other animals as well as in humans. So there is something about skin picking or hair pulling or nail biting that is biological. At the end of the day, for you to constantly, when you create a habit out of something, it creates neural circuits in your brain. So these neural circuits kind of enable further picking because they make it very easy and even unconscious. So there's, you know, that old neuroscientific maxim, neurons that fire together wire together. So when you repeat something enough times, whether it's a serve in tennis or skin picking, you always have this biological aspect. We don't currently have any evidence that you can inherit skin picking or hair pulling, but because grooming is present in other animals, we can say that there is perhaps to a degree a genetic component to it as well, although we really need a lot more research to say that definitively. But either way you look, you damage your skin, you damage your hair, all biological. You need some neurons to fire for you to be triggered. You need them to fire so that you can perform the physical action of picking or pulling. So there's always the biological side of things, right? There's the psychological side of things because skin picking or hair pulling take an emotional toll on you. Sometimes they serve a purpose of alleviating the bodily effects, that kind of excitation of the body when we have intense feelings. As you become more mindful of your picking or pulling, you will realize that there are often thoughts that come about just before you pick or pull. You have memories that come about. So there's a very, very strong psychological component. In fact, the research that we have as of 2023, when I'm recording this, the research shows that psychological solutions are far more effective than biological ones. So we could perhaps say that we can make this psychological circle a bit larger, this biological circle a little smaller, but we need both of these because BFRBs contain a very complex interplay between these two things. And then there's a third circle, the social circle. I took this chart from the Washington University School of Medicine. And then this plus and this square here is my highly sophisticated editing skills. Because I think the authors, this is from an article on COVID, so it's not from an article about BFRBs. I just took it because I think it's a nice illustration of the model. They talk about social components, and here you have interpersonal factors, such as social interactions and community activities. This is all well and true, but the most important thing about the social part in this model has been left out, which is the socioeconomic conditions. I will say a few words about this, and I'm always upset when this is left out, because that's quite literally what that circle is for. But because it is not very popular to talk about money issues or class differences, this is unjustly left out. But let's consider first what's written here. If you've been pulling your hair or picking your skin, then you certainly know how shameful that is. That could be one of the interpersonal factors. If you don't have a supportive environment, or if you're paralyzed by shame, you're very likely to hide your pulling or your picking. And people can be very creative. So, for example, a few days ago, I had a session with a client who pulls her hair, but then over the years, she reduced her pulling to pulling her pubic hairs because that makes her pulling quite invisible. And it all started because once someone mentioned her bald spot and asked what that was, if she has alopecia, and she was so shamed by it that she continued to pull, but just her pubic hairs, because that way pulling was invisible. So in this case, we see how social stigma or perceived social stigma actually helps you continue the behavior. So it's ultimately harmful. She just changed her pulling site, but she didn't develop healthier coping mechanisms. She just kind of succumbed to shame and became better at hiding it. And when behavior is invisible, then there is less of an incentive to change it. If you have, I don't know, partners or family members that are not supportive. So I was just yesterday, I was looking at some of the stuff that you were writing in the last of the prompts in the BFRB club. And there was one very kind of touching prompt about how family members have harshly criticized someone for their picking, and how that worsened both the shame and the picking itself, because it was stress and anxiety inducing. So that would be the social component. And and also the community thing is important. If you attend support groups, if you're right in our club, you're much more likely to progress and get better help, because you're you're connecting to other people who have similar experiences. So you feel like you're a part of a club, which makes us feel safer. There's less shame, and so less of a need to hide things. You get people who can genuinely support you from a place of experiential understanding, not just intellectual understanding. So that the BFRB club would be firmly situated in the social, and then a little bit in the psychological as well. And then why am I mentioning socioeconomic conditions? This is because we cannot control everything here, right? This is one of the reasons why I frequently rant against reducing BFRBs to just biological, because if you say this is genetic, then what exactly kind of help does that imply? Like, if it's your genes, then you're kind of destined to experience this, right? So if you look at it through, let's say, a genetic lens, this is why I would prefer to chop this up into more circles, but for the sake of simplicity, this is easy. If we think this is a habit, so neurons that fire together wire together, we can say that with a lot of hard work, through habit reversal training, you can create new neural circuits. You can rewire your brain. It'll take a long time. You'll probably have to deal with competing responses forever and ever, but you can do that. If you look at it as just genetic, then you already lost the fight, didn't you? Because what are you going to do? Mutate your genes? That's not going to happen, right? So in that sense, the biological perspective can maybe say this is going to be a chronic problem that you'll struggle with forever, but it's manageable. Or it can say, just drop it, you've lost. It depends on your interpretation of it, right? I think psychological component also has its limitations, whereas it can help you grow and transform yourself in extraordinary ways. If you stick dogmatically to this, you will then be blind to other perspectives. So let me give you an example. A couple of years ago, I had a client who pulled her hair, and whereas there were important topics that we talked about in psychotherapy in terms of setting boundaries, which reduced her anxiety, helped her kind of reshape her relationship with her girlfriend. So she did make progress. There was something about her BFRB and the whole presentation, let's say the whole clinical presentation, that didn't quite make sense to me. And then I asked her one day, how about if you go and do some blood work? And I told her what analysis to do, and she did. And turned out she had anemia. And this is the biological side of things. So picking is not necessarily just about your brain and brain chemistry or about your genes. It can also be about some health problems. And as she dealt with her anemia, her pulling almost completely disappeared. So here we needed biological and psychological. And the reason, so if I was, let's say that if I were a therapist that is blinded to other perspectives, and if I didn't have medical education, for example, I could only treat this as psychological, and she would make far less progress because I am yet to hear of someone who cured anemia through conversations. The reason why I'm mentioning this social part is that a part of her issue with anemia was that she was a woman in her reproductive period, so she's at a higher risk of anemia due to monthly blood loss. And second of all, she didn't have a lot of money. She worked 2 jobs, and she was exhausted, too exhausted to actually cook afterwards. So she would just eat fast food. And in general, so her socioeconomic conditions, in effect, caused or contributed significantly to her anemia, and then consequently to her pulling. We can never ignore socioeconomic conditions. In internal medicine and other, let's say, more physical branches of medicine, this is well known and well studied. We know that people who are poor eat poorly. So they can't afford high quality food, so they're more likely to eat fast food. And if half of your diet is McDonald's, then you're more likely to gain unnecessary weight. For example, if you do a physically exhausting job, when you come home, you're probably just going to sit in front of your TV, and this kind of lifestyle is also a problem because it's more conducive to conditions like diabetes type 2. So how much money you have also determines your access to healthcare. So perhaps your picking starts as a consequence of, let's say, making up a hypothetical case here. You're 14 years old or 15 years old, and you're an adolescent. Your life is very turbulent, as adolescence is. You become very anxious. You become insecure about your body, and you become anxious. However, let's say that your parents don't make a lot of money and you can't afford psychotherapy. So then instead of dealing with it right away and making your picking go away very quickly, it becomes a chronic habit because you couldn't afford psychotherapy. We know that medication is not very effective. So even if you have some kind of healthcare, you're very likely to leave a doctor's office with a medical prescription, and that's going to be either less effective or completely ineffective. And then you will continue to pick just because of your socioeconomic conditions. Because we know, and this is an observation that I think most therapists will agree with, it's a slight generalization, but usually when you have a problem that lasts for a long time, it is more difficult to solve than a short-term psychological problem. So when you don't have access to healthcare, when you can't afford psychotherapy, then you're more likely to develop a more serious or more difficult case to treat at some point. This is one of the reasons why I started the BFRB Club. If this is not your first webinar with me, and if you know me, you know how much I care about access to healthcare. I am not in the position to reform healthcare, but I am in the position to create a website that offers a place for you to learn from others, a place where you can get some useful information so that you can help yourself. This is why so much of what I sorry, I can't speak today. So much of the content of the BFRB Club is geared towards self-help and reflection that you can do on your own or with other people, is so that you don't actually need any money to get some help. I don't think that's sufficient, but that's about as much as I can do at this time. So this is very important, right? So class matters when it comes to health. Now, this sounds pretty comprehensive, doesn't it? It sounds quite holistic. In theory, you can make the case that it is. In reality, what happens is that if you go to a psychiatrist, you will leave the office with medication. Even if your problem is something that can be dealt with through psychotherapy, even if research shows that medication is worse than psychotherapy for BFRBs. And the reason why this is the case is because I know this because I went to medical school and I know what that experience is like. They will say, yes, all these things play a role, but at the end of the day, you are taught to prescribe medication. And then because I also went through psychotherapeutic training, I know that they will say, yeah, but ultimately, most things are psychosomatic. So mental health professionals, I don't place blame on any individual person here. That's not the point. But they are humans, except for me, of course. I have transcended humanity. Just kidding. If you're listening to me for the first time, my humor may seem a bit weird. But I'm also human. So we all have our biases. We all have our preferred theories. And if we're not very mindful of how we think, we'll just go with what we think is true by default. So we all do this. So perspectivism, even though theoretically it's there, in reality, it's really not, which is why it's extremely important for me as a therapist, for every other mental health professional out there, and for you, presumably you're listening to this if you're struggling with a body-focused repetitive behavior, is to be very intentional about looking at your symptoms as the intersection of many different roads. And these roads are not just the ones I've outlined. For example, I didn't mention gender as an issue. And gender and BFRBs have a very complex relationship. For many years, statistics, for example, would show us that women tend to struggle with hair pulling or skin picking far more than men. But then some more recent studies have shown that it appears to be equally distributed among genders. Only women seek help more frequently than men. There are things like what hair pulling could mean for men and for women. This is not the same thing. And then again, where do we factor in non-binary people here? So we need to have that aspect that gender also colors a person's experience significantly from both their kind of inner world from that perspective, and then also societally. Race also plays a very important role. And I mean this in the most practical way possible, because how, let's say, white women and persons of color relate to their hair is really very different. Hair can be almost political. There's so many layers to hair. So when depending on the texture that one pulls, there can potentially be a lot to explore in this arena. So there are countless ways in which your body-focused repetitive behavior is an intersection, a very specific one of different elements of your psychology. So we can say, to simplify things, that your skin picking or hair pulling is an intersection of different identities that you have, of different parts of your psyche, of the tensions your values create, or the conflicts of your needs. So there is no way to look at body-focused repetitive behaviors from just one point of view and say that's the one. We have to approach it from very, very different perspectives. If you want to learn more about gender or race and their intersection with BFRBs, I would be happy to create webinars on this, write blogs, find people to interview. I think it's a topic that I think is really important for my practical work as well. So let me summarize where we are until now. You don't need a complete theory of your BFRB. So you don't need one explanation that covers all aspects of your BFRB. Forget about that. You are far too complex as a person. Everyone is. I don't know of a single psychological problem that can be summarized in one sentence, and for that sentence to be meaningful and useful. You don't need to treat a single theory as the truth. So see what works, right? Is this useful or not? When you judge if something is useful or not, don't think about your resistance to things. Let me use one obvious example here. Gloves. many people feel resistance to using gloves. And then when I propose gloves, they say, oh, gloves don't work for me. And then I say, okay, but have you ever tried gloves? And then I will get an answer, either no, but I know that they don't work for me, which is an example of dogmatism. No, you do not. You don't know if something works until you've actually tried. Or they will tell me something, yes, I wore gloves for 2 days and I really didn't like it. They were not very comfortable, as if pulling or picking is just so incredibly comfortable, right? So when we assess if something is useful or not, we think, does this lead to reduction of symptoms or not? If it does, it's useful. If it does not, it's not useful. When we determine that something is useful, we can then weigh pros and cons, see what the quote unquote side effects of this approach are, and then see where this is useful, like what context of our lives could benefit from this technique, where we need something else. So be very specific, very much context oriented. Please don't fall into the trap of rejecting a theory before you actually test it, because then you are sticking to just one perspective and refusing to consider others. So this is very important. Remember, I started with defining perspectivism. So what I'm trying to say is that don't reject other perspectives just because they conflict with your basic premises, with your default perspective. The point is not to create a coherent intellectual theory of skin picking or hair pulling. The point is to find solutions that work. And when I say work, and when I say testing and giving something an honest try, I mean doing it for a week, 2, 3 weeks, doing it regularly, doing it diligently, analyzing the outcomes, exploring its implications for your lived experience, not just performing rapid thought experiments and discarding things. If you discard a solution just because it's uncomfortable, that tells you that maybe, of course, we're not talking about an extreme discomfort here. We're talking about mild discomfort. Then we're perhaps kind of another topic to work on is how to learn to tolerate a certain level of discomfort. Because emotional avoidance, experiential avoidance in general is a very strong component in many BFRBs. Right? Let your theory or theories evolve and multiply by following what works in your experience. And now, finally, hopefully someone is still listening to this. Let me explain how this works on the example that one of our club members so kindly shared with me. I mean, this is a person that really approaches introspection systematically. So we have here skin picking in the center. And then the purple boxes here show what her 4 immediate theories of why she picks her skin. She says, I pick my skin as a way to cope with stress. She says, I do it as a way to cope with anger. She then also says, I do it because of the emotional work I put in my everyday life. And I do it because of my lack of self-worth. If you're being very logical and rational and all this, you might see that this classification is really not very coherent. It's based on really just her observing her own experience. Like, stress is so general that you could put all these other 3 things in it. Lack of self-worth and emotional work could also perhaps in some way be one or deeply connected. But for this specific client, looking at skin picking as an intersection of these 4 underlying mechanisms, these 4 independent perspectives, is the best approach in her experience so far. And when I say in her experience so far, I mean that thanks to this approach, she actually reduced her picking, so it works. It doesn't matter that these are perspectives that are not entirely commensurable. So let's unpack each of these. Let's start with anger, because it's the shortest one. So her anger has, the way she sees it, 2 components. One is her ex-husband, So she lives with a partner and she's divorced. So the father of her child is her children, sorry, is her ex-husband. And so her ex-husband isn't really what you'd call an exemplary parent. He frequently changes appointment dates. So she can't really plan what to do when he has the kids. He doesn't contribute financially. In the beginning, it was irregular. And then recently, it has been non-existent. So she's really angry at him. And because his behavior is not going to change, she just ends up being angry. And that anger comes out through skin picking. So it's a way to alleviate the anger that she feels. In our correspondence, because VIP club members can use this possibility, they can send me questions, messages, thoughts, whatever they want, either publicly in the VIP section or via email. And then she kept, as we kept talking or corresponding, she started seeing her anger as really being not just, as picking not just being a way to cope with anger, but picking also being anger directed towards herself. Because her anger had to go out somewhere. And then, since it was pointless when it goes out towards her ex-husband, because he would simply ignore her messages or just hang up the phone or not answer, she would then direct it to herself. So skin picking was a way to get the anger out, to self-soothe, but also a way to be angry at herself because she somehow felt that she was the one who was doing something wrong. And then parenting was also a source of anger because when you work long hours, you have an ex-husband who doesn't help. You have a current partner who's struggling with depression. You come home and you have two young children who are just naturally impossible because they're very young. You get angry. And then when she gets angry, she also feels guilty because she knows that she's being angry at them because they're just kids. And then that also leads to skin picking. So this approach then led her to find anger management techniques for anger management. So this would be one facet of her skin picking. Another one would be emotional work. By emotional work, what I mean is that extra work that we have to put in, where we have to, present a certain face, be a certain way that conflicts with how we actually feel. There are two different terms here that I merged into one just not to complicate things. There's emotional work, which means that, for example, she could be feeling very tired and frustrated, but she has to pretend to be energetic and lively in front of her kids because that's how she imagines the role of a mother. That's emotional work. But her professional role involves customer support. So she talks to a lot of people, and then she has to be nice and kind and smiley, even when they're being complete assholes towards her. So that we call emotional labor because it's related to actual labor, right? It's an extra demand of her professional role. For example, when I think about emotional labor, waiters always come to my mind because I think they struggle with it almost as much as therapists do, because therapists are at least able to call out someone gently, though, on their behavior, whereas waiters have to smile even when you treat them horribly. And then instead of just delivering food, which should be the serving, customers, which should be their work, they have to put in extra emotional labor because they have to pretend to be thrilled to bring you yet another cup of another bottle of water or a glass of wine. Right. So her professional role in customer support also required a lot of emotional labor. And then her partner required a lot of emotional work because he struggled with depression and was kind of changing, well, still is changing jobs very frequently. So he's not very reliable as help. As a stepfather, he likes her children, but he really just doesn't have the energy to invest in that, to help her enough or spend quality time with them either. And then her father was also a source of great emotional work because he has dementia and she also takes care of him, and he lives a few doors down from her. So it's also physical work because she has to go there and take care of him. So you can see how all this can cause emotional exhaustion or a lot of the need to self-soothe, and then picking comes in as well. Lack of self-worth is another perspective. Now, we can say that the fact that she's maybe too patient with her ex-husband, even when he pushes all her buttons and breaks down all her boundaries, that this is a manifestation of her lack of self-worth. But for her, experientially, anger issues are a separate category. So this is what I'm talking about perspectivism. These perspectives don't have to fit in like a neat little puzzle for them all to be true and all to be useful. Lack of self-worth is something that she traces back to her adolescence when she started picking her skin. It all started with her not being happy with what her body looks like. And this has kind of, this struggle to accept and like her body has been present for, well, ever since her adolescence. She's now in her mid-40s, so almost 30 years, right? Or about 30 years. And with years of picking, there's some scarring on her body as well. She gave birth to 2 children, so that additionally kind of naturally changed her body. And she really struggles to like her body. She struggles to feel physically attractive. And because she feels unattractive, she doesn't really feel comfortable when her partner or her ex-husband, when they were married, would be physically affectionate to her. On the other hand, physical affection and physical closeness is a way for her to self-soothe, a way that she does not afford to herself very often because of her lack of self-worth and body image issues. So picking then remains her only resource. Her professional role also affects her low self-worth, because even though she does a very good job and is regularly praised by her superiors, her salary is just not sufficient. And there's only so much up the hierarchy that she can go. So she doesn't get enough validation and confirmation that she is good and successful and worthy. So this also kind of, this is, as you can see, anger and emotional work and lack of self-worth also kind of overlap, which is exactly what I mean when I say that perspectivism is a good approach, because you can approach her professional role as both lack of self-worth and work on it that way, and then also as emotional work, so teaching her how to set boundaries, how to approach work to protect herself more, and you're both working on skin picking and a professional role from perspectives that are just really completely different. And then there's stress as in my opinion, the vaguest category here. But again, from her lived experience, it's a category that makes sense. It's a part of her now explicit theory of BFRB. So stress comes from 3 different sources for her. One is money. As I already mentioned, her job is just not well paid. And she's not, from what I can tell, I really can't read minds, but she's not a very materialistic person. But she has 2 kids and a husband who doesn't have steady income. So there's a lot of pressure on her to provide for her family. So money is a great source of stress. She wants to be able to send her kids to college, but that means establishing a college fund right now, and she can barely make the rent and provide for her family. So this is an enormous source of stress. Motherhood is another source of stress, because she has an idea of what she wants to be like as a mother. And let's say circumstances outside of her control, such as money, her ex-husband's behavior, the time that her work requires, so things that she cannot entirely control, prevent her from being the kind of mother that she wants to be. And this sometimes leads to guilt, and guilt then leads to picking and causes her to be stressed out all the time, because she's always worried that she's failing her kids somehow. And she's also worried that maybe she can't even see all the different ways in which she's failing her kids, because they're very young right now, and just the older one is, from what I understand, just starting school. So she feels that her absence of her tiredness or her anger, or her complex relationship with her ex-husband, that all this will somehow leave a mark on how her children develop. And then motherhood, instead of being a source of joy, becomes predominantly a source of stress. Of course, she loves her kids. There's no question about that. But this is a great source of stress as well. And then she has thyroid problems. She has hyperthyroidism. This is, again, one of those things that I emphasized about how important it is to look at BFRBs from not just one biological perspective, which is this hereditary or not, but also as a side effect of other medical conditions as well. So she has hyperthyroidism, which one of the symptoms of is being very anxious and kind of being more susceptible to stress. She feels restless all the time. She even has mild panic attacks, let's say, sometimes. It doesn't quite raise to that level, but quite intense anxiety. And all this then leads directly to picking. And her doctors are not really able to, so far, they're kind of still adjusting the dosage for the hormones, for the drugs that she's taking. So this is not well regulated yet. It's a source of stress. And she's also worried because she doesn't know what thyroid issues mean for her future. So on a psychological level, not just on a biological level, this is an issue that also leads to skin picking. So you can see here that skin picking is an intersection of a multitude of perspectives. Calling it biopsychosocial really doesn't cut it. When you go down to the very specifics of this person's life, you see that in order for her to fully heal, she needs to address her skin picking from vastly different perspectives. Perspectives that are not necessarily compatible with each other, that don't neatly fit into one comprehensive image. Everything here overlaps, connects in some way, but at the same time, some of these require to be separated and dealt with individually. So this is an example of what I mean by perspectivism. Luckily, this person, and although she has been picking for now 30 years, in the beginning, she used to only think of this as lack of self-worth. And then she started thinking about it in more vague ways, such as maybe all of this is stress. And then she said, okay, well, stress explains some things, but I also pick when I'm angry. So she developed this. So it's from her own lived experience. And I will say a very systematic and admirable level of introspection that she developed this very complicated intersection of perspectives. Each of these is one road that contributes to skin picking. And all of these play an important role in the overall picture of who she is. So you can't remove skin picking from who she is as a person. So where to begin with this? The first and the basic thing to do is to see what is in your control and what isn't. If we go back to the previous slide, we can see that money issues are not entirely in her control. She can only work so many hours without further damaging her physical or psychological health and without feeling like a bad mother. And also just there's a certain number of hours that we can work before we just drop dead. So this is limited. Her profession is such that she has a salary ceiling that she will simply not cross. We know from statistics that class mobility is pretty much a fairy tale at this point. So financially, she's stuck, maybe not in the same place that she is now, but she has a bracket that she's going to be stuck in. There's space for movement, but not much. Motherhood is also kind of a fixed category for her. So she's a mother and nothing can change that. That brings in costs, emotional investment. It brings a lot of pleasure and she loves her kids immensely, but nonetheless, there are limitations here as well. Her thyroid problems are really not up to her. She can take medication regularly, go to see her doctors and do most of what her health insurance will cover, but that's about it. the problem is there and she can't deal with it. So there are some things, her ex-husband as well is a bit of a wild card. So there are some things that she cannot control. Those things that she cannot control, she has to accept as is. Because what else can you do? If you ignore them and pretend that they're not a part of your reality, you'll just continue to pick your skin further or pull your hair, if I'm talking more generally. So what's not in your control, you accept. What is in your control, then you can strategize about. Then you determine your priorities. Even though it is useful to see this as being a problem that can be approached and needs to be approached from different perspectives, at any given period of time in your life, you have to ask yourself, what is the perspective that is most useful right now? Or maybe two, but you can't do everything at once. So you have to prioritize. Then you have to, once you're done prioritizing and making your wish list, you have to look at it critically and see what's unrealistic there. What's too much, what's too little, and then adjust your list. I suggest you take a break between points 3 and 4. Leave it for a couple of days or a week, just so that you can get a different perspective. You can even offer it to someone. Ask someone in the club, email me, ask your friends who know what your life is like. That's quite useful as well. And then in the end, the most painful question, which is, what do I have to give up? What dreams I have to give up? What hopes do I have to give up? What activities I have to give up? That's usually very difficult. The key word here, or one of the key words, is balance. So life doesn't stand still. So our psyche won't stand still either. The perspective that is useful today might not be the most useful one tomorrow. So your identities will change, your values will change, your needs will change. So your healing journey can only make sense if you're mindful of where you are and where you want to go, and then balance your strengths, your potentials with your limitations in order to get there and reduce your symptoms as much as possible. But you have to keep in mind that you cannot set one recipe and then stick to it. Because, second keyword, life and mental health problems are not things, they're a process or processes. So healing from your BFRB cannot be isolated from the rest of your life. Without lifestyle changes overall, there can be no permanent solution, or at least not a sustainable solution, right? You're one whole. So all the parts of your psyche are interconnected. You can't dissect your hair pulling and then separate it from the rest of who you are. So you have to look at it as a part of a whole, but a whole that is approached through different perspectives. Each perspective has its strengths and its weaknesses. Psychotherapy, or personal development in general, because a lot of the things that you do in the BFRB club is self-help, right? I'm maybe guiding you in some way, but the work is all yours. So the successes are all yours. You cannot dissect this and say, I will not work on my burnout, but I will reduce my peaking. It's not going to happen. Chances are that burnout and peaking are also connected in some way. On the right here, you have a painting by Paul Jenkins. He's an abstract painter that I sometimes like, sometimes dislike, depending on the day you ask me. But when I thought of the word process, his paintings immediately came to mind because there's this kind of movement in them. It's almost like this is a snapshot of a process that continued to unfold afterwards. And then, of course, for the keyword process, there's another example. I wouldn't be me if I didn't have artsy examples. So what you see here on the left are Michelangelo's sketches for a piece called the Libyan Sibyl. And so you see here different facial expressions, different positions, him working out positions of like her feet here, her hands, musculature of the body, and then you see the final product. So this is not an image that I took. This is from the Sistine Chapel in Rome, in the Vatican, but in a bizarre twist of events, the Vatican has sold rights to taking pictures of the Sistine Chapel. So you're not allowed to take pictures in there. So this is someone else's image that I found online, but this is the final product. And in order for him to arrive at this rather stunning depiction here, he had to go through many stages. So this was not an image in his mind. It's a result of tweaking and trying out different things and probably consulting with other people, because no one gets 100% artistic freedom to create what they want. This was created for the Catholic Church, so they probably had some input as well. Another important keyword is self-compassion. And we have a whole course, as I said in the beginning. So you have videos, meditations, all of it. You can work through it yourself or with me. The overall goal of any kind of healing and growth is obviously to suffer less. So the fact that you're on this journey to reduce your skin picking or hair pulling is already a form of self-compassion. Being mindful of your stress levels, your thoughts, emotions, is really something that you cannot avoid in a healing process of any kind. If you're going to achieve proper balance, you need to be mindful, and you need to know that the goal is to suffer less, not to produce more, achieve more, stop overnight, but to suffer less. That means that you have to focus on attainable goals, even if they are imperfect or unsatisfactory. But imperfect and unsatisfactory is what life will give us. So this is from an Instagram post on our BFRB club page that Jordan, our designer, created. And I took it just to show you that when you think about progress and process and balance, don't think about something linear. Like, we have linear progress on this first image, but then we also have this progress here and this progress here. So progress is something that is very different. Many different things can be progress. You can perhaps reduce your picking for 3 months because you just have the sheer willpower, but then relapse. Or your picking can reduce slowly over time if you, let's say, work on accepting your emotions or being more compassionate yourself. I'm throwing out generic theories now so that I can give you examples, but obviously it'll be different for every person. So don't compare yourself to others. The way that others change has nothing to do with how you will change. You have your own path, and then, as Dante said, segui il tuo corso e lascia dire le genti. So follow your path, and let other people talk, let them do their thing. Don't compare yourself. Your path is your own and no one else's. And then, of course, patience as a very, very important keyword. We addressed this in last week's webinar, so I will not go into details. I will just read the quote by Marcus Aurelius, since echoing the previous webinar, he's still in my head. If someone is able to show me that what I think or do is not right, I will happily change, for I seek the truth by which no one was ever truly harmed. It is the person who continues in their self-deception and ignorance who is harmed. So basically, he says, just observe carefully, listen to, in this case, what your body tells you, what your needs tell you. Be ready to change perspectives when your experience calls for it. Right? And that is everything I have to say. As always, if you have any questions, you can use the Ask Away link if you're in the VIP lounge. I've established a new schedule, so from Monday to Thursday, I'll try to get back to you within 24 or 48 hours. Also, I've noticed that some of you hold back, so I will give you a response, and then you're kind of shy to continue the conversation via email. That you perfectly can do that. Like, if you're in the VIP lounge, you can respond as much as you like. So use the option that you have. I'm very grateful for everyone who is in the VIP lounge, because your support allows us to pay for the whole website. It allows us to pay the designers that work for us, and to kind of provide more services. But I also invite you to not just support, but to use the services that you have access to. There's also a technical bit of news. I moved all the blogs from my drmiletic.com website. That's just more kind of my CV online. I've moved everything to 4 Steps Coaching so that all of it is on one platform. It just seems more logical that way. So thank you very much. And I hope this was not as abstract, or it didn't end being as abstract as it was in the beginning. I hope you enjoyed it. And also, if you have any suggestions for webinars, use the suggestion box in the club, and I'll be happy to create whatever content you'd like to hear.